AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome. I'm Lorena Anderson, your life and energy coach. Welcome to our show, You and Your Doctor, where we teach you how to live a longer and healthier life. It's being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. And I just have to tell you that with their level of care, they do have unbelievable patience. They have learned how to listen so closely to the patients that they have the ability of really connecting with them, with feeling the compassion and the tenderness that's so important, especially when you need home health care. So we are here. We're live every Tuesday, 6 to 7 on 1470 AM. And also 95.3 FM. And in case you missed our show tonight, you can also listen to us on 95.3 FM on Tuesdays at 11 o'clock AM and 3 o'clock PM. So please join us there as well. Plus, you can also find all the shows archived on allcountyhealthcare.com. And we are streaming live tonight on wwnnradio.com. You and Your Doctor is the name of the show. So welcome. It is wonderful to have you here. And as usual, thank you, All County Healthcare, for bringing on some absolute amazing professionals in their field, the experts. And today we happen to have Dr. Green with us. He's a dermatologist that has come, who has a very prominent business practice out there in the community, located up in Boca Raton, and I know he's an absolute amazing professional, expert in his field, but you would never be able to tell it. I've got to tell you, whatever he's doing to promote his practice with all of his patients and everything, he's using on himself too, because he looks quite young.
Oh, I appreciate that. Thank you very much.
You're welcome. Welcome. And thank you, Dr. Green, for coming on tonight.
My pleasure.
So tell me, first of all, one of the things that I've noticed is that the majority of the doctors that I have, they have found their passion because of something that has happened in their childhood, or somebody who has kind of ignited that passion, opened up the doors for them. Tell me how you managed to get into dermatology.
Well, my story is actually very interesting. I grew up in South Florida. I used to love the sun. I used to lay out in the sun. I grew up on the water. And it wasn't until years later, even when I first got into dermatology, where I really started understanding the effects of the sun. So it wasn't until medical school where I was deciding what kind of field of medicine I wanted to go into. And I started thinking, I'm great with my hands. I'm very creative, and I love people. So maybe surgery, maybe pediatrics, maybe even family practice. It wasn't until a cousin of mine, who's a dermatologist himself,
there you go,
said,
family member.
Please come shadow me, come volunteer with me, and see what dermatology is all about. And when I did see what dermatology was about, and I started realizing what a visual person I was, I realized this was a field for me, where I can build up relationships with patients, take care of them, do procedures, and have happy patients walking in and out of the door. And that's an amazing aspect, and it's a wonderful thing to have in my practice.
I totally agree with you. Yes, and the majority of the time, I would imagine they would be walking out happy campers, huh?
It's a really nice thing when you can help people get rid of their skin cancers, get rid of their problems, make them feel prettier outside as well as inside, and help patients really feel good about themselves, and that's what we do.
That's fabulous. Good for you. So how long have you been practicing? I mean, where did you go to school?
So I went to college at Emory University in Atlanta. I'm born and raised in South Florida, but I got a little time away from South Florida. So I was in Atlanta, then I came down to University of Miami for a graduate program, and then I went to Nova Southeastern University for medical school.
Oh, wonderful. So right here, huh?
And then I got 1 year away in New York. And while I was in New York, after that 1 year, I'm coming back for dermatology to nice South Florida, to warm South Florida, and planted my roots, and I've been here ever since.
I love it. What, you don't like the cold?
I have nothing against the cold. I'm going next week to go skiing. I like the cold for short periods of time.
Yeah, I totally agree. Well, I'm from Chicago. I grew up in that cold, and I swear to God, I'm like cold traumatized.
I love Chicago in July.
Thank you. That was exactly my point. I love Chicago in the summer.
Yes.
And sometimes you don't even get summer in July, though. But it is wonderful. So tell me a little bit more about your practice. How long have you been in practice?
So I've been in practice for about 11 and a half, 12 years.
Okay.
I was in Fort Lauderdale for majority of that time. Mm-hmm. We had 2 practices in Fort Lauderdale, one in Aventura and one in Bay Harbor. And then we sold our business, and the company that bought our business said nothing would change, and unfortunately everything changed, meaning my old practice was patient focused. Mm-hmm. And I think quality of care is very, very important, and that quality of care gets lost when a big company takes over. And that to me is not what medicine's about. I love what I do. I love my field. I love my patients. And I don't think a dermatology practice should ever be a factory, and I put my heart into it. I treat my patients like their family, and I treat them how I would like to be treated. So quality care was essential to how I would want to practice. So I left and I started a new practice in Deerfield Beach, and I built a really nice practice surrounded by incredible employees. My employees and I give that quality of care that patients deserve.
I love that, and I just want to say kudos because that's what I'm finding. All of the professionals and the doctors that I've had on the show have got this wonderful bedside manner, that they really do care about their patients, that they're quiet, they're calm with them, they listen. I've got to tell you, that is an exquisite skill set to be able to really listen to what the patient is going through, and to work with that, whatever the patient is telling you, to be able to work with that in order to give them that level of security, and also to be able to help them in whatever they're dealing with. So kudos. I'm so happy to hear that.
Please, I think it's very, very important to listen in a conversation and to understand the other person and where they're coming from. You can't help them if you don't know where they're coming from. So you have to communicate well.
And not only that, but giving them the time to be able to do that as well. Because a lot of doctors, as you just said,
See, that's the thing. If you have a factory, you don't have that time.
Yes, exactly. So how long have you been in your business, your practice right now?
So my new practice in Deerfield Beach, we opened up in August. So we're looking at 4 months ago.
Wow.
So it's relatively new.
Okay.
And we built a facility that's big enough for the future, because it's large inside and plenty of room. So the patients have, they can have quality care in every exam room. The patients are treated like they are VIPs. Each person is treated like a concierge type of practice.
I love that. So how do they get a hold of you?
So my name is very easy. So Jason Green, Green Dermatology.
Okay.
Very, very simple name for the practice. They can get a hold of us at 954-481-0650, or they can go to drgreenderm.com. I'm right off of 95 in Hillsborough East.
Okay.
There's a shopping plaza, it's a professional association plaza.
Okay.
Right off of Natura Avenue. I apologize.
No, that's okay.
And it's in a medical campus. So, and this medical campus where there's other physicians, we're the only dermatologists there. Tons of parking, and it's very easy to find. But if you call the number, the 954-481-0650 number, we'll help you out with directions. Or you go online and find us that way too.
Oh, excellent.
Yeah.
Excellent. And in case you have any questions whatsoever for the doctor and he's no longer, on the show, you can call here at the show, 888-565-1470, or call All County Healthcare, and that is 888 717-7170. You can ask for Maddie, and Maddie will make sure that your information gets to Dr. Green.
That'd be great. Thank you.
Yeah, absolutely. Absolutely. Well, we're teaching our audience, our listeners, how to live a longer and healthier life. Well, part of that is that ability of being compassionate, being caring, being available, and all of those are essential to the well-being of the individual. So I thank you very much for making that your mission statement, because for me that's very important. I'm in the business of life and energy, so in that business I have to be exquisite in my listening, because there's so many different variables that are happening with not only the language but the body language as well. So I'm sure you're very much aware of all of those various subtleties.
I think just not even spoken language, but visual language and understanding what their body language tells you, it's important. For us, we do our best to allow our patients have the time to communicate. We show compassion. We care about our patients. We try to offer our patients top-level service in all fields of dermatology. Anything they need, we're here for their help.
Oh, I love that. That is wonderful.
Yeah.
That is just wonderful. So again, if you have any questions for Dr. Green and you weren't able to call in this evening, please give All County Healthcare, Maddie, a phone call. That's 888-717-7170, because she can put you in touch with Dr. Green, well, with any of our guests that we've had on the show. And also, if there's any questions that you might have about home health care, call Maddie. She can help you, no problem whatsoever. So tell me a little bit, not only does that level of compassion and care and tenderness and listening capabilities make you different out there in the workplace and in your practice, what else makes you different? What else?
A couple of things that really make our practice different is that we are offering a new procedure to remove skin cancers. In the past, we would do surgery. We would do different procedures such as Mohs surgery to remove skin cancers, but now we have a machine that actually it's called an SRT. It does superficial radiotherapy to remove skin cancer without cutting, which means there's no pain, no scars, and no downtime. And essentially what we're doing is we're doing superficial radiation to denature the actual cells of the cancer, and each treatment is about 25 seconds long, so it's less than 30 seconds. They come into the office, and it's 30 seconds of radiation focalized only to the skin of the cancer site, and it takes several treatments, but you get rid of the cancer without a scar, without pain, and I'm telling you, there's no downtime. It's a very easy procedure.
This sounds evolutionary.
Not many practices have this, so yes, this has actually been on the news. This is definitely revolutionary, because you think years ago, before they had anesthetics and before they had sutures, and you look at the world is not just flat any longer. We know it's round. There's other ways to get rid of your cancer other than cutting.
Wow.
So you can really make a huge difference, and we try to offer this as another service provided to patients. And the great thing is insurance does cover this.
Really?
Yeah.
Oh my goodness.
Yeah.
That is absolutely astounding. Many times what I've been experiencing is that somebody that comes in with skin cancer, especially Mohs, they have to cut and cut and cut. Say that there's just a little round spot on your nose, and they have to cut and keep sending in samples to make sure that they've gotten it all.
You asked me a question earlier about how I got into dermatology.
Yes.
I'm going to tell you another thing about my past that led me to get this machine. I had skin cancer on my nose also. Like I said, I'm born and raised in South Florida. I'm a blue-eyed person with fair skin, and I used to
It's
love the sun.
amazing that I would be pointing to my nose for that cancer.
Right. So it's almost like there's a setup, but there really wasn't.
Yeah, no setup. No.
And I had a skin cancer, and I had the old procedure, the Mohs procedure, and I have a scar. And once I heard about this procedure, I looked into it, and I thought, hey, just imagine I could have had this done years ago without having a scar on my nose. It's just a revolutionary treatment that should have been offered years ago. It just wasn't out there. And now that it's there, it's something that I can offer to patients that can really help them out. They can get rid of their cancer without having scarring, without having the pain of the surgery or the bandages or anything that's attributed to the fear that people have when they have a skin cancer. So
That is absolutely, totally amazing.
It's definitely revolutionary. It's amazing.
Yes. Revolutionary, evolutionary.
That's the way we're working towards, yes.
Absolutely. Oh, my God. Insurance covers it. There's only 3 or 4 30-second sessions that you have to go through?
No, not 3 or 4. So the average is anywhere from 12 to 15 treatments.
Okay.
Each treatment is less than 30 seconds long. So it takes longer for the patient to actually walk into the office first, to set them up in the chair, than to do the actual treatment. So my patients walk in and we build a relationship. We call it almost whether it's like dating or having just, their field trips to the dermatologist, but we say hello, we laugh, we have a good time. It takes a couple of minutes to set the thing up, and then they're out the door. Wow. And it's a really simple process, but it gets rid of their cancer. I actually did this on my grandfather.
Really?
Yeah, my grandfather had a skin cancer in his head, and I said, listen, you've had surgery before. How about we do something different that doesn't leave you with a scar or doesn't hurt you? And he was all for it, and now my grandfather's cancer-free on the top of his head, so...
That is absolutely incredible.
Yes. To do it on your family is a wonderful thing, and to have that trust.
Yeah, absolutely.
And to know I can provide that to them, that was a wonderful thing for me, too.
That is really amazing. I'm in shock. And it doesn't cut the skin, and
no
it doesn't...
At all.
And you're not taking any of the good tissue?
You're not. So with the other surgeries, you're always concerned about taking the least amount of tissue because you're causing more normal, healthy skin to be removed.
Right.
This doesn't do that at all.
How long has it been out?
It's been only out for like a few years. I'd say 5 to 7 years.
Okay.
Just not many people have it yet.
Yeah. Now, what is the name of
the procedure is called SRT, superficial radiotherapy.
Wow. Okay. Yeah. Well, I've got to tell you, listeners, if you are dealing with something of that nature, please give Dr. Green a call because, first of all, there's no downtime, there's no cutting, and your insurance pays for it. And I'm thrilled to hear it.
Besides having a wonderful new option for removing skin cancers, obviously it's better to prevent than to deal with something afterwards. So prevention is key. If people can come in, the average person after age 30 is supposed to have a skin exam once a year. If you have a history of skin cancer, you're supposed to come in twice a year. So seeing your dermatologist is very important. So obviously an ounce of prevention is worth a pound of cure. That's really where you want to start the ball. You want to make sure you're taking care of yourself before you even get to that part.
Yes, absolutely. However, some of our listeners might be a little more senior. They didn't understand or know what was going to happen way back when we used to slather ourselves with iodine that was in baby oil iodine and lay in the sun for hours.
Listen, I understand you, and I still tell my patients, I'm not telling people to stay away from the sun or to avoid. Just do it more responsibly. Use the right sunblocks. Make sure you get checked. Make sure you try to stay in the shade. So wearing the right sunblock is the biggest question people ask me. They say, well, what number is important? What number should I have? And I tell them it's not the number that matters mostly, it's the ingredient. It has to have zinc oxide. Okay. If your sunblock has zinc oxide, it'll protect you against the harmful UVA rays, which cause majority of your skin cancers.
Oh, okay. Yeah. So, audience, did you hear that? Okay.
Dr. Green's words are zinc oxide in your sunblock.
That's great advice. Absolutely.
Like I said, if you can prevent, that's key. If you've already had damage and you haven't seen a dermatologist, I urge you to please do so because it's important. Yes. And if you have something that concerns you that you feel is suspicious or does not heal, please get it checked out. And there are options out there. Like I was saying, there's new options. Instead of having to be cut upon, we can help get rid of skin cancers in other ways too. So don't be fearful.
That's excellent. Now, is that just for one type of skin cancer, or does that cover a range?
You brought up a very good question. It only covers basal cell carcinomas and squamous cell carcinomas, the two most commonly found skin cancers. Does not cover melanomas. So non-melanoma skin cancer it removes. Melanoma, still we need to do surgery for. And that's the one we really want to prevent when we're doing skin cancer checks. Because melanomas are serious, and that's why we encourage skin cancer screenings.
Where are some of the areas that you can find that melanoma?
Melanoma can be found anywhere on the body, from head down to toes, including toenails.
Really?
Bob Marley, the famous reggae singer, he passed away from a melanoma on his toenail.
Really?
Yes.
I did not know that.
Well, there you go. Every day a new piece of information.
I got to tell you. So under the toenail.
Well, you know something, the reason why we get skin cancer checks is to make sure there's nothing on our back or in areas where we don't look or we wouldn't even think to look. Mm-hmm. You know, you want a trained eye, a professional to look you over. It's very, very important.
Yes,
And
absolutely.
one of the things you asked me about what I do in my practice, I do medical, but when I do medical skin checks, I'm thorough. I'll look even between the toes, bottom of the feet, because it's important. Because women, for example, have a higher predilection to have skin cancers, melanomas in the lower extremities.
Oh, my goodness. No, I didn't know that.
It's important. I mean, you should have a trained eye looking you over.
Okay. And also in the scalp area, from what I understand, I've heard
Down
of
the
some.
toe.
Yeah, I've heard of some of the beauty salons, some of the
Hairdressers find
hairdressers
all the
finding,
time.
yes.
Yeah, anyone who looks at the skin anywhere can find something, but when it's yourself, I can't even look at my own back. So it's important to get a skin check. Skin checks are definitely essential.
Excellent. What other great advice do you have for us?
I'll give you some other interesting things that we do. They're not just medical. We can go on the fun side of dermatology. The fun side is keeping people looking younger, happier. We do some cosmetics. We do a procedure called Kybella. That's like the newest thing. It's a new injection that we use. It's FDA approved for submental fat for the double chin area.
Yes, I'm familiar.
So there's a product that we use to get rid of the double chin, but it can also be used off-label for other areas, such as the lower abdomen fat, love handles, even the hanging underarms, bra fat. So there's little techniques we can use it in different places. A lot of people have the jowls that hang from on their jawline here.
Yes.
And we can use it there as well.
Yes, it's been called turkey neck, unfortunately.
Well, we can get rid of the turkey neck. Thanksgiving's long gone. So
Thank you.
we can help you there.
Absolutely. Very interesting. Okay, so that's Kybella. What else have you...
Another great product that just came to market is Bellafill. Bellafill is a long-lasting filler. So for years, we would do fillers to revolumize people's faces.
Right.
When people lose the collagen, you get these, it's called marionette lines and nasolabial folds, so these deep lines between the nose and the mouth where you smile. I used to do fillers all the time for people that last only anywhere from 6 months. Now they last up to 9 months to a year.
Oh, wow.
But there's a new product called Bellafill that lasts 3 to 5 years, so it's considered a semi-permanent filler. And instead of paying every year for fillers, there's a way to do it that'll last you a lot longer. So that's pretty novel.
That's quite amazing. What else? You're so full of knowledge. I love it. I just want to keep pulling more and more out.
We have other fillers that we use in the hands. People think of looking at, always trying to make your face look better and younger, and that's true, but people forget about the hands. The hands are a great giveaway of someone's age. So we can revolumize the hands. When you make a fist, you can see all the veins. There's ways to hide that. We do lasers to get rid of all the brown blemishes on the hands, the face. Lasers are also good for the smoker's lines around the mouth. Not just putting fillers in, but lasers can smooth and tighten the skin. Mm-hmm. So,
excellent.
Any other questions? Please bring them on. I'm here all night.
Well, unfortunately, we're coming to our end, but I've got to tell you, Dr. Green, please tell them again one more time where they can call you, what your address is, where you're located.
The telephone number is 954-481-0650. The address is 260 Southwest Natura Avenue. It's Suite 101, and it's Deerfield Beach. It's right off of 95 and Hillsborough, literally right off of 95 in the Deerfield Beach Professional Center.
Okay, great.
Would love to have you guys come anytime you need.
And also give them your website.
It's Dr. Green Derm, so it's DRGREEN Derm, DERM.com. And you can see what our office looks like. You can take a virtual tour. You can see everything that we offer, from our own product line to every medical condition we treat. But please call us up, email us, any which way. We'll be more than happy to help you out.
Wonderful.
And I didn't tell you, we have extended hours too.
Really?
That means that we work earlier in the mornings every single day of the week. We work Wednesday evenings and also Saturdays. We are trying to cater to anyone with any busy schedule. We're here to help you out.
That is wonderful.
Yes.
Good for you. Another amazing professional that we've had on our show this evening. Thank you again for being here.
Thank you so much.
Oh, it's my pleasure. My pleasure. Now, don't leave. Stay tuned. We're going for a commercial. We'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor, where we teach you how to live a longer and healthier life, presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. You can find us here every Tuesday evening between the hours of 6 and 7. We are live on 1470 AM and also 95.3 FM. And just in case you've missed our show this evening, you can also listen to us every Tuesday at the hours of 11 a.m. and 3 p.m., where we replay our shows from the previous day or previous week. So welcome. It's great to have you. We have another fabulous guest, another expert in his field that has come to join us, taking time out of his busy schedule to come and join us. And I'd just like to say thank you so much to All County Healthcare for providing these experts, because our whole show here happens to be to educate you, to give you the best knowledge so that you can make those choices that are so important to you when you're going through your health care, when you're trying to make those decisions about either your Medicare or which one to choose. The other thing also is that other areas also affect our well-being. So we've had guests on that have been reverse mortgage individuals, Medicare insurance individuals. We've also had attorneys that specialize in gerontology and our seniors, and also healthcare advocates. So if you have not had the opportunity of hearing us prior to this time, you can also go to allcountyhealthcare.com, because we have all of our shows archived there. Now, if you have any questions for All County Healthcare Home Health Services, please call 888-717-7170. Ask for Maddie. She would love to help you in whatever way she can. And also, if you have any questions for any of our doctors, you can call Maddie as well. So without any further ado, I'd love to introduce our next doctor. So doctor, welcome. Please share your name with us.
How are you?
Good.
Noah Schreibman. I'm a pulmonary and critical care specialist in Boca Raton and Delray Beach, Florida.
Oh my goodness. Okay. So most of the doctors that I've had on the show, they have shared with me something that had happened in their childhood that awakened them to their particular field. Do you have some such story as well?
I think all doctors probably have a story similar to that. It's just, I think at a young age I realized that I thought that a lot of my talents were involved in helping other people and trying to enrich the lives of others. I can't think of anything particularly specific. I guess most doctors, the first time you go to the pediatrician and you see, how hard they work and how enriching of lives of other people they make.
Yes.
It makes a big impression on you.
Yes, it sure does. And your particular specialty, what had you decide to go into this particular field?
Hard to say. I mean, when I first started doing my medicine residency, I found the intensive care unit very exciting, very challenging, very stimulating. You basically go in there every day. You don't know what you're going to see. You don't know what you're going to find, and that freshness of it, as well as the organized chaos of the intensive care unit, so to speak, really drew me to it.
Wow. And what particular thing, what do you do in the intensive care? Because you're a pulmonary specialist, correct?
Yes.
So what exactly is it that you are paying most attention to?
Well, in the intensive care unit, a significant portion of patients that end up in the intensive care unit have respiratory difficulties, whether that be from pneumonia, whether that be from asthma, emphysema, or related to other body systems. For instance, people with kidney failure or people in congestive heart failure often have major respiratory issues as well. And, but that's one of my main focuses is doing whatever I can to sort of improve the statuses of those particular people.
I see. Well, it's very interesting that I have you on the show, because it was only 2 weeks ago that one of my dear friends, her daughter, at age 16, was in intensive care, and she ended up with pneumonia. She had a couple seizures, and she ended up with pneumonia. And I have got to tell you, the things that went on in that room were absolutely mind-blowing. I could not believe all of the various equipments, all the tubes and everything that were coming out of the nose that were attached to her heart, her head. I mean, it was absolutely amazing. And then I watched as the nurses and the doctors would come in and be checking all of the equipment and making sure that everything was functioning properly. So I commend your profession by all means. And she even had respiratory distress syndrome, acute. And, the mortality of that, from what I had read, is anywhere between 20 and 50%.
That's correct.
Within one day, she had it, and it was gone. So, and I attribute that to the kind of care that you do in your profession and how you take care of the patients. So I commend you for that. It's very difficult. And you're right. You never know what you're going to walk into.
It can be quite challenging.
Yes. What are some of the common things that you see in your office? Or in not only your office, but also in the ICU?
Especially in our patient population in South Florida, there are very few patients that have just sort of one body system on the fritz. Usually if somebody has a particular symptom, such as chest pain or shortness of breath, there's usually more than one factor involved. We see, unfortunately, the effects of multiple decades of smoking in a significant portion of our patients, and that can manifest itself with either emphysema, lung scarring, congestive heart failure, heart disease, kidney dysfunction, liver dysfunction, increased risk of stroke, and all these things can sort of interplay with each other.
Wow.
That can really compromise a person's health.
That's the effects of smoking. Oh, and I just want to tell the audience, if you are smoking, please do whatever you can to quit. It is absolutely essential. It's imperative because you're really putting your life at risk. The doctor here is a perfect example of things that he has had to deal with because of that particular addiction.
And the funny thing is, when I was, just in training back about 20 some years ago, a major study came out that literally proved that about 20% of a physician's patients will quit smoking with nothing more than the doctor basically telling them to quit. So, it sounds funny, but 1 out of 5, it's not bad if you're doing it saying, "Hey, quit."
Yeah, just quit. Okay, now you've got your life and energy coach talking to you as well. Just quit, please. Absolutely. So how long have you been in business?
Graduated medical school in 1996, finished my medicine residency in 99, finished my pulmonary and critical care training in 2002, and I've been in South Florida ever since.
Wow. And where did you go to school?
Medical school in the Bronx at Albert Einstein College of Medicine, and I did all my residency and fellowship training at Temple University in Philadelphia.
Wow, okay. So are you originally from up north?
South Jersey area, about 10 minutes from Atlantic City.
Okay, great. Well, it's wonderful to have you down here because I know there's so many people that are in need of your skill set. So that's excellent. So give us a little bit more insight as to some of the state-of-the-art technology that might be coming out to help these various diseases, the respiratory diseases.
There's a big push in medicine as far as genetics, trying to find a genetic underpinning for every single disorder. And, while there are some disorders that have a known genetic problem that cause them, Down syndrome, being an obvious one. Mm-hmm. A lot of other medical conditions have what we call genetic predispositions. In other words, you have two different people who are both 80 years old, and they have both smoked 4 packs of cigarettes a day since they were age 20, and one person has completely normal lungs and completely normal lung function, and the other person has basically end-stage oxygen-dependent emphysema. Well, what is it? Well, they both smoked the same. They both lived in the same area. What exactly is it that made this one unfortunate person susceptible to all these things, and this other person spared? And that's where a lot of research is going now. Is there a genetic predisposition to all these things? Even infectious diseases, are there genetic predispositions for why some people get pneumonia more than others? Are there genetic predispositions as far as why some people get heart disease and others don't? So that's one of the biggest pushes forward in medicine these days.
I see. I would think that would be blatantly obvious. That you might have two people and they're living together and they're smoking the same, but the genetics of the individual are completely different.
There's studies amongst people that live in the same community. There are studies amongst similar family members, with very similar genetic traits. Mm-hmm. And is there something that sort of differentiates? And it's a very interesting field. It's a little bit away as far as having resolution as far as what the exact issues are, but that's something that's a big topic of research now.
Mm-hmm. Well, it's kind of like taking a look at the heredity of it. What is your mother and father dealing with? Is that something that they've had a predisposition to, and naturally you would have a predisposition to it as well?
It's one of the reasons why whenever you interview a patient for the first time or even subsequent visits, family history is always something that we're always very focused on, and that's
Mm-hmm.
not just that's not just a pulmonologist speaking. That could be any type of physician. Family history is usually paramount in trying to figure out what the various problems of a person are.
Yeah. Well, it comes back down to nature and nurture. Some of it's just nature. That's what you're born with because of the genetics. And then nurture is how have you managed to take care of yourself, or do you take care of yourself? And so you're working with two different pieces there that combine to make one whole person. But one you have absolute control over, and how you nurture yourself, how you manage to take care of yourself. Are you exercising? Are you limiting your alcohol intake? Are you eating properly? Are you getting enough nutrients in the body? And the other one happens to be, as you were speaking, more nature, the genetics of your mother and your father. So what else is happening out there in the world, in your world of
Big push now in hospitals, and this is one thing that we're particularly interested in, especially at Delray Hospital where I'm on staff, whereas the way that the intensive care units are run has changed, where within the last 10 to 15 years, there's been a new quote-unquote specialty created called the intensivist, which is sort of like an end-all, which we sort of think of ourselves as sort of knowing a little bit about everything when a patient is critically ill. So instead of, in the old days, somebody comes into the intensive care unit and they're sick, and depending on what body part is wrong, maybe you're going to have a heart doctor seeing that patient, a lung doctor seeing that patient, and a kidney doctor seeing, and so it's almost like you got multiple specialties seeing that patient at one time, and it's almost like the Tower of Babel with multiple doctors fighting with each other about various aspects of patient's care. Now what's happening is that a patient goes to the ICU, and there is a quote unquote captain of the ship now who is the intensivist who runs the patient's care. And then the theory behind it is that the nurses always have one go-to person to ask when there's a problem. The families have one go-to person to specifically ask for questions about how their loved one is doing. And the theory behind it is that it makes care better, it streamlines care, it makes care more efficient, and everybody benefits. And that we're a big part of that in Delray Hospital now.
Are you? Wow, that is fabulous. Because you're right. Because so often what ends up happening is that you've got, 10 doctors and none of them are really communicating together efficiently. So you have like that interim person where, all that information is gathered and put into like a core. And that core then can assimilate all that information back out to, other doctors or to the family members, other nurses on staff.
These models of how the intensive care unit is supposed to work basically originated in academic medical centers, and now they've sort of filtered out to community hospitals like the one that I'm involved in Delray, and trying to make this there's a movement to make this a countrywide thing, because just because a patient is not necessarily at an academic center, that doesn't mean that their care should suffer. And this is one of the ways that we sort of ensure that doesn't happen.
I really like that. And it's so important to just have one person, because many times, I know that in that intensive care position, first of all, the family members, they're not thinking straight anyhow. And the trauma that's going on inside there, and the drama as well, and they're just beside themselves. So you could be talking to them and communicating, and they're not even hearing you because they're so emotionally traumatized at that point. So I love the fact that there is that one individual that the family members can go to. All the doctors can go to as well.
We actually, the way it's set up is that the day usually starts about 7 o'clock in the morning. At 10 o'clock, we hold what we call, and the term we use are called multidisciplinary rounds, where we do our own initial assessments as individuals from say 7 to 10, but then from 10 to 11:30. The ICU team rounds as a group on each individual patient. By the ICU team, I'm talking about the doctor, the nurse practitioner, the pharmacist, the respiratory therapist, the social worker, the case manager, the physical therapist, anybody that's involved in any aspect of that particular person's care that day, and we all round together to sort of formulate a plan for the person on that day. Then we do a few more hours of work, and then we pretty much set aside from, say, 1 in the afternoon until 2:30, and we call those our quote-unquote family rounds, where the families know that if they need to reach us, we're there, like, exclusively for them for just those 90 minutes and so forth. And like I said, it helps for alleviating anxiety amongst family members. It helps for alleviating anxiety amongst nurses about not knowing who to call if there's a problem, and it just sort of, there's no way to make an ICU without chaos, but it sort of controls it and stabilizes
Organized
it.
chaos,
Organized
right?
chaos. That's how we phrase it.
Oh,
all the time.
okay. That's how it sounds. Because if everybody, because it can be pretty chaotic, but it seems like there's that level of communication between each and every facet and how they come together. It's very interesting. What else do you end up seeing in the ICU that has you concerned? Okay, I know that you're dealing more with the respiratory, with the pulmonary. What else do you see?
Well, the thing that's disheartening is when, like I said, this population, we're a little skewed in this area of the country because of the general age of the patients that we see. But when we do see younger people in our ICU, it's usually due to one of three things: either alcohol abuse, tobacco abuse, or drug use. And that's and as I tell people all the time, and as I tell my own kids, these three vices, they cut across all religious lines, they cut across all socioeconomic lines, they cut across all educational lines, they cut across all gender lines. Nobody's immune to it at all.
Right.
And that's an eye-opener.
Yes.
And one thing that pretty much every doctor who has kids does is you basically parade them you take your kid to work day. We parade our kids and we force them into the ICU and we show, hey, okay, you think it's funny? You want to end up like that? You want to, and that's like there's no better way to teach people to stay away from that stuff and to show people the
results of it.
The results of it.
Yes. Although, with teenagers, they often feel as if that would never happen to them, like they're immune to it.
Until it happens to a friend of theirs,
Yeah.
which unfortunately happens way too often.
Yeah. Yes. Well, addiction is a big criteria out there, and something that we work very hard. Parents work very hard on making sure that they teach their children that this is. It can be real problematic. This will stunt your ability of growing, your educational values, and where you want to take yourself in life as well.
It destroys the person. It destroys the person's friends, and it destroys the person's families. I've seen entire families just demolished by this because you can't. How do you get? You lose a kid. How do you? Losing a kid under any circumstances is horrific. But when you lose a kid to something that's eminently preventable, it's mind-boggling and it's devastating.
Yes. Well, and I was a therapist in the addictions field, so I'm very familiar with not only the juveniles in there, but also the adults. And both sectors are dealing with, a disease, yes, but it's a preventable disease as well. You don't pick up. There's the bottom line. You don't pick up.
It's a horrible thing to have to witness.
Yes, it is. Absolutely. So, and that's what you're seeing more and more in the ICU?
Yeah, if it's elderly patients, it's the result of years upon years of chronic illnesses that just sort of go bad all at once. Younger people, almost, if it's not trauma, it's the effects of illicit substances.
Wow. Okay. Thank you for that information. And listeners, please keep your eyes open and be aware if you see any signs. Share with us some of the signs of
I'm sure your audience probably knows this as well, especially if they've gone through this specifically. But the things we always, doctors are very regimented, OCD type people, so we're always into patterns and behavioral norms. So if you start to see patterns change, that's something to look for. You've got a 17-year-old kid that shaves religiously, like twice a day or once a day, and all of a sudden they go 2 weeks at a time without shaving. Meticulous about their hygiene, then all of a sudden you notice they're not
taking showers.
Not so observant about it anymore.
Right.
Grades suffering, personality changes, sleep habits change,
right.
Eating habits change. Any sort of thing. Anything that you people say, I know my kid. Well, if you know your kid and all of a sudden your kid's not acting like the way you know your kid always acts, and I always tell people, you got to trust your own judgment. If you think there's something, you're not going to put the idea in somebody's head. We tell this to people all the time. If your kid is not doing drugs, asking them if they're doing drugs is not going to make them say, it's not going to plant a seed in their head, hey, maybe I should do it. It doesn't work like that.
Yeah, I'm being accused of it anyhow. I might as well go and do it.
It doesn't work like that. You're not doing any harm by bringing the subject up. It's the same. It's and the analogy we always use is, again, this is another thing we see. And I guess if you ever have a psychiatrist on your show, they could talk about this in more detail than I could. But when you have a person who has suicidal thoughts, asking that person if they have suicidal thoughts does not make the situation worse. You're not putting the idea in their head. If anything, you could be curbing something terrible from happening in the first place. So again, so going back to the first topic we were talking about, you see behavioral changes, you see any kind of differences in that person's pattern than what it usually is. There's nothing wrong with asking. You might be surprised by the honest answers that you get.
Yeah. Yes. Well, I appreciate that. How do they get a hold of you, doctor? Please share.
I'm one of three guys, and we have two offices. We have one office in Boca Raton, Florida, across the street from West Boca Hospital, and we have another office in Delray Beach, Florida, about a 2-minute drive from Delray Hospital, and the office number is 561-488-2988, and with modern technology, that number connects to both offices. So if you call that number, you can it'll reach you to whichever office you choose to prefer.
One more time with your telephone number, doctor.
That would be 561-488-2988.
And please spell your name for them.
Sure, it's S like in Sam, CHREI, B like in boy, MAN.
Okay, great. Well, I can't thank you enough for being on. We love the fact that you've been able to share with us some of the things that you're dealing with in the ICU, and also bringing us awareness to what we need to be looking at and being aware, trusting our gut when we see something that's not right, not only with our children, but also with our parents. Because a lot of times, parents end up already being retired. And they're in an environment that, they don't have to get up for work anymore. They get to lounge around a little bit. And they also might pick up alcohol a little too much. So I appreciate everything that you've shared with us. And I'd also like to say thank you again to All County Healthcare for bringing these professionals on, for educating us, being aware of what we need to look for in order to maintain our healthy way of being, and if we're not, what we need to do to get healthy. So I'm Lorena Anderson, your life and energy coach. Thank you again for joining us. Remember, we're here every Tuesday between the hours of 6 and 7. We're here to help you live a longer and healthier life. Until then, we'll see you next week.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show. Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as